at sixes and sevens would like to welcome today Dr. William Scheier. Dr. Scheier is the owner and practitioner in advanced family dentistry of Cape Cod. But today we're going to talk about the next level of his practice, which is the Snoring and Sleep Apnea Treatment Center. Mm-hmm. Now, why do we want to talk to Dr. Scheier about snoring and sleep apnea? Because it's particularly an issue for people between 60 and 80. That doesn't mean that there's no problem that shows up earlier, but it is an issue of people not really admitting what an issue it is, what a problem it can be. And admitting usually takes place after 60 for a number of reasons. Mm-hmm. And Dr. Scheier is going to tell us about the issues, and he's going to describe some of his treatment approaches. But mostly he's going to try to persuade and motivate people to not treat snoring and sleep apnea as though it's unimportant. It's very important. Mm-hmm. Dr. Scheier, tell us why it's important.
Well, I think those are all real good questions, and to begin with, I'd like to maybe step back for a second and again state that I am a general dentist, and that any general dentist could be aware of what we're about to talk about. Personally, I took a lot of my training with the Jesuits, and the Jesuits have a pillar of their church that's called Cura Personalis, which is the care for the entire person, as opposed to just a dental approach. And so what it suggests is looking at the patient as a whole as well as just in their mouth, so that basically boils down to a respect for the person in their entirety, their needs and their wants, as well as how they feel about what they want. So given that, I've always tried to model my practice around having a more medically oriented dental practice than you would say might be average. Relative to the snoring and sleep apnea portion of it, it's a huge area of concern today, that we know that in the United States, if we go on what most of a range of percentages that we hear from either the National Sleep Foundation, the American Academy of Sleep Medicine, the American Academy of Dental Sleep Medicine, we know that there are somewhere in between one out of every 4 and 1 out of every 5 adults in the United States has some form of sleep disordered breathing. And that, with 300 million people in the country, that's quite a number of people who are mostly undiagnosed. 90% of people who have it, it's estimated, are undiagnosed. And I think part of that is the identification, and part of that is the as you called it, the admittance that you have a potential issue. Yeah, so who better to evaluate the snoring based on what happens in a person's throat and mouth but a dentist? Number one, we see their patients more frequently than they see their physicians. Right. We have a better feel for what the oral cavity is supposed to look like if you're properly trained. And in our case, we have a screening test that can be administered in 5 minutes to determine whether a patient's at risk or not. And this screening test has to do with a clinical exam, a questionnaire, a sleepiness questionnaire, an Epworth sleepiness questionnaire, as well as some other examination of medical history, comorbidities such as high blood pressure, heart conditions, diabetes, again, impotence, depression. All of these things can have as a contributing factor sleep apnea. But my point is to get a patient screened and then tested and then treated are basically the three steps that we like, to perform. And again, who better to do that than dentists?
Tell me this, have most people who come into your treatment center, have most people had these problems for many, many years and just ignored them? And it's hard to imagine that people could ignore it, because sleep occurs every night or part of every day. But people just live with it, and then all of a sudden will be open to you saying something. What causes people to suddenly say, "Tell me why I snore," for example?
Oh boy, that really hits at the heart of it, and it's again back to the admittance thing. I mean, we have it's a myriad of approaches, but for instance, we have people say, "My wife told me to come here because I snore too much and I can't sleep in the same room," or "My husband." And so it sometimes approaches that. A lot of times in dentistry, especially, and I've learned this in my 25 years of practice, first you have to tell someone something, then you have to tell them what you told them, and then you have to tell them what you told them that you told them before they start to have some sort of, I guess, agreement toward it. Now, unfortunately, in a case of sleep apnea, or even in a case of a tooth, if you don't treat it, it a lot of times gets worse. And with sleep apnea, what I think we've shown in our screening and explained very succinctly in our screening is that this is a continuum of things. It starts with mild snoring that has no symptoms. Then it goes to perhaps snoring with some symptoms such as upper respiratory resistance syndrome, sleepiness.
What is that, short of breath?
Or, well, that's further along, certainly.
Oh, I see.
Yeah, and then sleep apnea, which is apneic events where people are tired or have other comorbidities, high blood pressure again, any heart conditions, obesity, certainly, all of these things. And the continuum, unfortunately, ends at death by asphyxiation.
Right.
I mean, so it's not something that's a social nuisance anymore, snoring. We've realized that. And it's not everyone that snores has sleep apnea, certainly, but there are certainly other clinical signs that go along with that, and medical history signs that go along with that. And the only way to tell if you have it or not is to have a sleep test.